It's your girl, Ariza, licensed clinical social worker, test prep guru, whatever you want to call me. I'm here to help you pass that exam. So whether you're a first timer or a repeat test taker, this is the place to get the tools, the strategy, and the mindset you need to level up and pass that exam. So today we're going to jump into it, guys. Yes, today we're diving into some heavy hitting terms that often come up in mental health work and on the ASWB exam as well. So we're talking about those negative symptoms. I have people ask me, what are negative symptoms? What are they? What do they mean? And we're going to go over some thought processes like the delusions, hallucinations, the anhedonia, the bizarre thinking, and all that and much, much more. So I'm sure you haven't seen a video like this, but if you ever wondered what's the difference between an illusion and a hallucination, what does anhedonia even mean? And how do delusions show up in real life cases? Stick around because we're going to break it all down in a way that makes sense. I'm going to give you examples so you can actually use them, actually remember, and actually recognize them on the exam. So let's start out with, what are negative symptoms? Negative symptoms are about a loss or absence of normal functioning. It's things like anhedonia. That's the loss of pleasure or interest in things you used to enjoy, often seen with clients with depression and diagnoses like schizophrenia. Then you have that flat affect, lack of emotional expression, like it's a poker face, but not on purpose. And then you have that allogia. That is that limited speech output, short answers, minimal conversations. And let's see, abolition. That is a lack of motivation, or it is the inability to not only be motivated to do things, but it's also the inability to what? What are you thinking? If you lack the motivation to do things, you also lack the inability to what? Initiate. Yes, initiate activities. Initiate the desire to want to do, to want to engage, to want to participate. All of those things. That is the abolition. So when you see these terms and you see these words, oftentimes they're recognized, or should I say they're shown when you're dealing with clients that have severe mental health issues, like the psychotic disorders, the schizophrenia, the schizoaffective, the schizophreniform. If somebody has bipolar, but with the psychotic features, those type of things is when this typically shows up. So let me give you an example. You have a client, they used to love art or music, and now they don't even pick up a pencil, pen, or radio or anything relative to the art or the music that they once enjoyed. That's the anhedonia. That is that in action. They no longer have that desire or that will or that want to do the things that they once absolutely loved, or should I say enjoyed. That is something you want to look for when you're working with clients. A lot of times clients will tell you a thing or two, but when you probe a little bit more, you'll realize that is more to it than meets the eye. So for instance, I'm meeting with a client and I'm like, hey, how are things going? They're like, great, things have been wonderful. Oh, awesome. How's things been going playing the guitar? Oh, I haven't played in a week. That's a red flag, because if this is a client that always plays the guitar, then all of a sudden they're telling me they haven't did something in over a week. Life has not been preventing them from doing it. It is something that I need to recognize and see. Is it just them being bored, needing a break, or something more going on? That is the thing that you have to understand and recognize when you're working with clients, these terms and how they relate and how they pertain to the actual client at hand. Let's move on to talk about these thought processes and disruptions. Yes, these are kind of my favorite when we talk about the delusions, and let me stay put. All right, delusions are those false beliefs that are held even when there's contrary evidence showing that it's not true. So you have the persecutory delusion. That is like the FBI is out to get me. What do you mean the FBI is out to get you, bro? It ain't no FBI out here. And you ain't even living a life where the FBI would even be thinking about you. So what's going on? That is questionable. You want to kind of look and see like what's going on with this person. That would be a delusion, but we call it persecutory. Another type of delusion is grandiose. Grandiose means like you're kind of on top of the world. I just think of grand, these feelings, big energy. But when someone has a grandiose delusion, they often have these big feelings and beliefs, but about oneself. So a grandiose delusion would be, I'm the chosen one. I'm here to save the world. Really? I didn't get that memo. That is what you might be thinking. However, it is another way to respond. Obviously, if you're working with someone and they're delusional, there are certain steps and certain things that an individual would do, and that's another video for another time. But just staying on track. Persecutory, grandiose are types of delusions. Another one is somatic. I'm sure you guys have heard of somatic. They might believe something like, oh, my stomach is filled with worms. Ooh. They might truly believe that. Regardless if you're able to say, well, let's go to the doctor, let's get an x-ray, let's let them look and examine, and they're able to see the proof that that's not the case, but they still feel that way. So that is something that often happens with clients that have somatic delusions. And somatic, you already know that's a disorder. So we're not talking about the disorder, we're talking about the delusion, but they kind of tie in together because somatic is somatic. Another one is the erotomanic. That's kind of like the romantic one. That is the one where they feel like people love and desire them, like, oh my goodness, can you believe that so-and-so was looking at me through the TV and I just know they want to be with me, or that celebrity has a thing for me. They've been sending me love messages and signals all day, and you can see them singing that song to me. Yes, those are the types of thoughts and the things that an individual would have if they have this type of and you think of romantic when you think of this, and this is pretty much what romanticizing the delusion, and that is what this one is. And then you have some other ones. There's quite a few. I'm not going to dip and dive into all of them. These are the common ones that you're likely to see if you're working with a client and you're delusional. Now, a clinical tip, the reason I'm giving this to you and the reason I want you to know is that you always want to explore how these beliefs affect this person's daily life and their safety. Because if they're hella delusional, you want to make sure that they can be safe and they're not harming themselves or other people with their thought processes. You also want to consider that about their daily life. Like, what are they doing each and every day, and how are they able to maintain this thought process and still function in society, whether it's working, whether it's holding down a job, or whatever it may be. Those are the things you want to consider and you want to look at. All right, guys, real quick, I'm always talking about the community, the LCSW vibes. We leveling up, and this is the sneak peek of the community. As you can see, it's on and popping. We got a lot happening. I got ethics over here, human development, or study guides that you guys asked me about on the YouTube channels, all right there. Test questions. You just want to level up and learn and see if you can answer those questions. I'm testing your knowledge. Let me go back to the home screen. If you want to learn more about what services I offer and what other things are there, that is where you go to the learning tabs. We leveling up, so why don't you join so you can level up too. The next one are my favorite, and that's hallucinations. You watched my last video. I gave you the 5 types of hallucinations, and I broke them down based on the senses. And I'm not going to do all that today because, if you watch the other video, it'll just be kind of repetitious. But hallucinations are perceptions without external stimulus. And, I'm not going to get all worried on you guys. We're just going to keep it real and say hallucinations are basically when people hear, see, and taste and smell and touch things and feel things and stuff that ain't even there. We don't keep it plain and simple. That is a perception that they have, that they believe they're hearing things, they believe they're seeing things, and it is not happening. That is a hallucination. One of the most common types are auditory and visual hallucinations, where individuals saying they see something or definitely hearing things. A lot of times when you're working with a client that has schizophrenia, you hear them laughing or giggling, and it's some things going on internally that you might say, what's so funny? What's going on? You're just not in their world. They're like out of touch with reality. So what they see, what they hear, and what they're thinking and stuff is not going to align with what you have going on. So it's one of those things you definitely want to be mindful of when you're working with clients that have disorders like schizophrenia. You have those visual hallucinations. Of course, these are not as common as the auditory ones, but they can occur, especially if someone's under substances or they have some type of medical condition, something along those lines. They begin to see things that are not there. So you just want to be mindful of it when an individual says that. They say, oh my God, you see that cat in the corner? And you're like, whoa, a cat in the corner, I don't see nothing. That would be a visual hallucination. And then of course tactile is very popular because you'll hear people say, oh my God, I have all these spiders crawling all over me. I can feel them crawling on me, but nothing's on their skin. That is a tactile hallucination. All right, so you got the delusions, you got the hallucinations. So let me go ahead and talk about this one. I very seldom talk about this one, but this is the illusion. This is a misinterpretation of real external stimuli. So this is really something that's going on. However, it's being misinterpreted. So it's illusion. I like to think about an illusion like when we think of like magic shows. So an auditory illusion, not delusion, illusion is like hearing the wind, but you think that is whisper. See, so it's a real thing that's happening here. The illusion is happening. So like when you see a magic show, the magician is actually doing some things, but how we see it and how we take a thing is not actually what's happening. So for instance, if the wind is blowing, we know it's real and the wind is actually blowing, but the individual that's having an illusion might hear the wind telling them certain things, or they might hear the wind and think it's whispering to them or giving them guidance. That would be an auditory illusion. Another one would be a visual illusion. That is like a coat on a chair. looking like a person. So like if I had like a hoodie on the back of my chair and a client that was dealing with illusions walked by, they might believe that the chair was a person looking at them because the coat or the hoodie resembled a person and they just felt like that's what it was. Again, guys, these are their illusions, all right? So there are a lot of them. You have the tactile illusions. Basically, you're thinking that a bug is crawling on you and all that kind of stuff. You have the olfactory illusions where you're like smelling a candle and thinking that the house is on fire. Like the candle is actually burning. We can see the candles burning, but we believe that there's a fire coming from that. The person that's having the illusion believes that. So hopefully this is not confusing. You want to think about it like this. Hallucinations are pretty much like you're dealing with the senses. So they're seeing, hearing, thinking, seeing and hearing things that are not there. So it's kind of like dealing with the senses, but the delusion is a thought process. They're thinking something and believing something that, contrary to what has been shown to them, is not happening. And then the illusion is similar to a delusion. However, this is really happening. So for instance, an delusion, we might feel like, oh my goodness, do you feel the wind blowing? And there's no wind blowing. That's their delusional. They believe that the wind is blowing, and even though we're outside and it's raining outside or it's really sunny and no one else around can feel the wind blowing, they might. That is a delusion. However, an illusion is the wind is actually blowing. We all know the wind is blowing, but that individual is hearing something. They believe that the wind is whispering and telling them things. That is an illusion. So it's kind of a misinterpretation of the actual thing that's taking place. Hopefully that makes sense. I know this can be really tricky. You might want to watch this video a few times just to really hone in to break down some of these things, but I'm trying to explain it to you as easy as I can. And because I know it's a little complex, 9 times out of 10, your girl probably is going to do a cheat sheet for this one, and it's going to be thrown in the community. So you can put in the comment section, cheat sheet, and I'm gonna respond to every last 100 of y'all and say in the community for the cheat sheet. Hey guys, I stopped by to tell you this. You do not have to win alone. Absolutely not. People in the community are winning each and every day. The proof is in the pudding. Go in the community, it's free. We're throwing down test questions, case studies, the FNBM method, all the details and everything you need so you can succeed. Click the link in the bio and join. You don't need to do this alone. See you soon. So think about that when you look at the difference between a hallucination, a delusion, and an illusion. So I want you guys to practice that, know it. Is it likely to be on the exam? Probably not. But is it something you should know? Absolutely so. So just keep that in mind and focus on it. Remember, illusions are different from hallucinations because they're based on something that is real. It's just misinterpreted. That is the best way I can explain it. And moving on, let's talk about that bizarre thinking and negative thought processes. So when we have that bizarre thinking, that is pretty much when individuals have this odd or just illogical way of thinking. Like it just does not make sense. It doesn't make sense. We're trying to make sense of it, but I don't know if you understand what I'm saying, but it just don't make sense what they're saying. An example of that would be like your neighbor controls my thought. Like somebody says, oh, my neighbor controls my thoughts with the remote control. Bro, okay, go get that remote so I can help them control it. No, we don't do that. But on a serious note, that would be an example of someone having bizarre thinking. We know, those that are in touch with reality, should I say, that the neighbor cannot control this individual's thoughts with the remote. However, they believe that they can. All right. So one of the other things is that that will fall in this category, bizarre thinking, negative thoughts, is the actual negative thoughts. So with the negative thoughts, you would think of, let's say, cognitive distortions. This is a really big one. So with cognitive distortions, it's kind of like that black and white thinking. It's like no in between. And they're just like, it's either this or it's either that. I love saying that. But that is pretty much what a negative thought is. It's a cognitive distortion, and it's pretty much black and white thinking. You're not, the individual is not generalizing things. They're kind of overgeneralizing, looking at it from this way and that kind of thing. They're not overgeneralizing. I apologize. They're looking at it this way and looking at it that way, and that's just what it is, that negative thought process. Example would be like, I failed the test, so I'm a complete failure. What? And a lot of times you see these negative thoughts when you're dealing with clients that have what? Yes, depression, some form of thinking that is not conducive to the betterment of themselves. And the reason I say that is because when we think of cognitive distortions, we normally think of what? Yes, CBT. Yes, cognitive behavior therapy. You guys are killing it. You guys are so smart. So yes, when we're working with someone that has negative way of thinking, which a lot of our depressive clients have that, they just have, the world is just horrible. The glass is always half empty. You know, life is just throwing them all the lemons and they can't even catch them to cut them up and try to make lemonade. It's just, life is just lifing for them. We have to get them a way to deal with that negative thought process, or we like to say the cognitive distortions, and see things in another way. So what we would do with those individuals is kind of like just helping them see that there's another way of seeing things. Like, yes, you failed this test. However, that doesn't make you a failure. It just requires you to study a little bit more, or to get some more guidance, or what can we put in place to help you be more successful next time. Like, you're going to have to really help them because they have a distorted way of seeing things. And no pun intended, I know a lot of you that are repeat test takers, you've had that negative thought process. Like, oh hell, I ain't never gonna pass this test. This is crazy. This is too much work. I'm stressed. I'm not paying no more damn money. I'm sick of this. I just have to find me another job. I'm going to find another profession. Blah, 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 blah. You guys have said it all. Trust me, I have been on the receiving end of those phone conversations where supervisees have called me and said, hey, I'm done. I'm done. And I'm like, no. We try again. And what I also tell them is, give yourself a day. Hell, give yourself a week. Give yourself however long you need to get or have to you able to truly get your mind right and really refocus and get back in the game so you can start studying and doing what you need to do. So that is pretty much the negative thought, the cognitive distortion, the CBT techniques, and all that kind of stuff. We can utilize those things on ourselves, with our clients, our loved ones, and so forth. So when you use CBT to challenge or to reframe some of these negative thought patterns, you are using that to help challenge these cognitive distortions or these negative way of seeing things. So definitely want to use CBT for that. All right, so let's apply some of this stuff. Let's talk about some clinical application, like some assessment tools, some things that we can utilize to help individuals that are dealing with these delusions, hallucinations, and all these things that I'm mentioning. So some assessment tools would be like using interviews or standardized assessments to just clarify whether the clients are actually even experiencing hallucinations, illusions, delusions, or any type of negative symptoms. You would need to use some type of assessment tools. And then of course, treatment planning. We want to be mindful of how we help individuals when they're having this thought process, and making sure we can effectively treat them or teach them ways and skills and tools to be more efficient in what they do. So if you're struggling with this and you're like, look, all these damn terms, illusion, delusion, it's just too much, you might need to check your sister out. You might need to join that community, look at my schedule time for us to chat, and maybe you need a little additional support. Now, not just for this, but just some additional support with how you're understanding your information, how you're processing information. A lot of you are really truly investing in yourself by doing a private tutoring, and I absolutely love it. But you know, if you're meeting with me for private tutoring, what I tell you to do first. Yes, you gotta learn the content. So it doesn't matter if you have my course or another course, you're gonna hear me say that all the time, as long as you have a course or a way to study and a way to learn the tools and skills you need to be successful and get done what you need to get done. That's just, I'm saying that now and I'm gonna stick by it. So if you join the community, at the very minimal, you're able to connect with like-minded individuals that are able to help you tap into a learning style or a way. One of the things I absolutely love about the community that I noticed this week is that people are actually coming together and forming study groups. Absolutely. You have people in there that are testing within the next 30 days, within the next 60 days, and they're actually forming groups. They're getting on a Zoom call, they're connecting with one another, they're exchanging information. Some of these individuals have completed courses, some of them are just waiting for their test, some of them are just getting ready to knock this whole test out the water. However, they are actually helping and investing in the people who are on their way to doing the same thing, so they can continue to learn with one another. So I think that's pretty dope. I just wanted to share that with you guys. That's another benefit of the community. It's not just coming in there, getting all my cheat sheets and just connecting with seeing what I'm going to throw out and give you guys. It is actually connecting and meeting friends, building your resources, your community, and so forth as it pertains to this test. Are you studying for the LCSW or LMSW exam? Don't waste time on the wrong prep. Try my test prep program for free with a full module that gives you the real strategies, the real practice, and real results. Plus, you get access to my exclusive test prep community where you'll find support, study material, and accountability. No risk, no stress, just results. Click the link in the bio so you can get ready to win with the winning team. All right, now let's talk about treatment planning again. So we're talking about delusions. Normally you want to do some reality testing, some gentle challenges. Like, you don't want to challenge them too much. You got to be real mindful. I've had some clients who I've tried to challenge some of their delusions, and let's just say I didn't continue to do that. So you just want to be mindful how you do it. So I want to say a gentle challenge. And then a lot of times these individuals need some type of medication because they might be really lost. They might have really lost touch with reality. And you talking to them and trying to ground them and do some reality testing and all that stuff, it just might not be appropriate depending on where the client is and how they're functioning and how they're actually engaging with you through the process. All right, and then you have hallucinations. A lot of times when individuals have hallucinations, you will will possibly be able to do some grounding techniques or things of that nature. But again, this is where medication comes in. Those antipsychotics are probably a must when you're dealing with a client that is having hallucinations or some of these other psychotic symptoms. Anhedonia, that is more of a behavioral activation. Like, this is where you want to do some CBT techniques, some type of behavioral therapy intervention where you're actually helping them learn and explore the meaning behind the activities they once did and the importance of trying to get reconnected and to continue to do those types of things. So those are some of the things you really want to look at and do. And then of course with the negative thoughts, we're just going to throw in that CBT. Definitely CBT. You want to help this individual identify and then challenge those distorted ways of thinking. It's just a must. You just got to do it. It's just no ifs and buts about it. That is a requirement. All right. So I hope this video was hella helpful for you. I hope you were able to take away some notes and some things. I got a few more notes that I'm going to go over with you. But I just want to tell you that you're amazing. You're doing an excellent job by investing in yourself. Time is not being wasted by taking a moment, watching videos, my videos, other YouTube videos, just instilling in yourself a level of knowledge that maybe you didn't have prior to watching the video. So just give yourself kudos, give yourself a pat on the back for showing up and showing out for yourself. If you're watching videos and that's the only thing you're able to fit in, so be it. Give yourself grace. Not everyone has the same availability. Not everyone has the same time. Not everyone has the same resources. Not everyone has the same finances. That's what makes us all different. So don't beat yourself up. Tell yourself that you got this. You're giving it all you got and you're using the tools and the resources you have to be successful and to be productive. I have dozens, hundreds. I know it's definitely tons of people, and I have not been able to calculate it all, that reach out to me, whether it's through TikTok, whether it's through Instagram, whether it's through YouTube, whether it's through the community, direct message in front of everyone in the community, telling me how much these actual videos have helped them towards their test taking journey and they have passed. So I have so many people that are getting wins from just watching the videos alone. However, I know they're just not watching them. They're actually meditating and letting it sink in, and they're actually taking notes and they're actually replaying them and they're watching the videos 2 and 3 times. So I know the system isn't, let me just watch videos, I'm gonna pass. No one's showing up on that level. However, the videos have been very instrumental in helping them do just that. So if that's the only thing you have right now, because you have depleted your ability to invest in any other kind of way, so be it. Make this work. Watch the videos, go in the community, download the cheat sheets, and do what you need to do so you can be successful and level up and pass this exam. Because you got it. This is your year. This is your year. Speak it, say it, and know it. That you're going to be successful. You're going to pass this test. You have the knowledge and the ability to do so. I just felt like somebody needed to hear that, and I wanted to share that before I actually move forward in this video. And of course, make sure you like it, make sure you subscribe, make sure you tell another social work friend, because every social worker knows another social worker. If you know another social worker, that social worker knows a social worker, and I guarantee you that social worker knows another social worker. So just keep it going, guys. Keep it going. Let them introduce them to the new kid on the block. Either way, you get the gist. Make sure you share it, show me some love, drop me something in the comment section. And the key takeaway, put in the comment section, what is the delusion, hallucination, and illusion? What are you thinking when you hear those terms? Are they easy for you to understand? Do you get tricked up? Which one just confuses the hell out of you? Or if it all makes sense after this video, just comment. It all makes sense. So hallucinations are the perception without a stimulus, and illusions are the misperceptions with real stimulus. All right? Hopefully that makes sense. And then of course you got those negative symptoms: no desire, no willingness to do the things that you once enjoyed doing, just lacking the motivation. All those types of things fall in the negative symptoms category. And a lot of times individuals that have lost touch with reality, whether they're dealing with some type of psychosis or psychotic disorder, should I say, or dealing with some type of mood disorder, you'll see some of these negative symptoms and things present themselves. So hopefully this was helpful for you to understand, and hopefully I was able to clarify for you. I appreciate you so much for sticking through and watching the video. And I know that you got this. Until the next one, have a great day.